Okay, hi Edward, it's Dr. Buford. We're just getting started on your left shoulder here. We're looking at it from the back to the front. Everything's magnified 30 or 40 times on the screen, as you recall. And now the first thing we're going to do is look at the biceps tendon. We're going to take a shaver here so you can smooth out some of these rough areas that we see, including the undersurface of the torn rotator cuff. So as we look at this biceps, I mean, there's signs that it's slowly starting to wear down a little bit. We can do a soft tissue tenodesis, and that's one way to take care of this, to make sure that we won't be leaving behind a biceps that could cause you pain in the future. And that seems to work pretty well. We'll look up at the rotator cuff since we're here while we're getting the other things ready to go. And here's this hole, pull back and look out. Here's this hole in the rotator cuff. Primarily right in here. And we know from the scans that it's essentially full thickness. So we're going to first deal with the biceps tendon. We'll take a spinal needle. And there that is, going right through the biceps tendon there. What's our pressure and flow set on? Turn our flow down for me. And then we'll take another instrument called the grasper. See how we bring that white suture back through, and then we're going to do the same thing one more time with our spinal needle. Okay, looks like a good spot. So we'll go ahead and feed the relay through again. And here we'll go ahead and grab the needle, or grab the wire rather. Okay, so now we've got that suture going all the way around the biceps, kind of in what we call a purse string stitch. And so now we're going to release the biceps down at the bottom here. Pause, please. Yeah, no, that's fine. Okay, so now we're going to go ahead and look around the rest of the shoulder. We'll look towards the back. We'll look all the way towards the back. Hole in the tendon that we've identified here. We're going to go ahead and start fixing this. So this is down into the joint. You can see the articular surface, which is that white, smooth-looking cartilage. We're going to take a spinal needle and pass it down here. That looks like a pretty good angle right there. So we'll go ahead and take a scalpel, make a little nick in the skin. And then into that nick, we're going to go ahead and pass this punch. you don't have a very wide footprint. It's pretty narrow, so we'll go ahead and place our suture anchor in right about here. And then next you'll see our suture anchor coming down. There it is there. We'll start it in the same hole we just made. Push in. Okay, and now we'll unload the screwdriver. Feels very solid. We're going to reach in from the front and spread the sutures apart and then decide which ones we're going to work with first. Okay, so there we can have a look. Looks like we want the black and white one first, so we'll reach in front here. Take this black and white one. We'll make sure we're not unloading by holding tight on the other suture. Got it? Very good. And so now we've got this black and white one in the front. Go ahead and reach in from the back with our suture hook. So here's our hook coming in. And then this allows us to hold on to the cuff. We're going to try and reduce it like that. So follow me back to the right. So we'll pull back and we'll start about here. And you can see it's coming through right there. That looks pretty good. Okay. And now we're going to go ahead and load that with the black wire. Hold this posterior cannula. Pull tight and you see what happens here. There we go. And so now we're reaching to get the partner sutured. We're not going to tie these yet, but we just want to get the sutures out of the way in order here. So the next one in order is going to be, let's see which one we think it is. So now we want the blue and white one. Okay. And now we'll reach in with our turn to the left suture hook. And this is what we're trying to do here. Here's our hook. So we want to end up about here. We'll hold it reduced and pass our hook. There it is coming through. Push cannula. Start on the spring. We'll pull tight. And then once you have it through, we'll go ahead and get the partner blue and white suture. Next we'll use the straight suture hook. And back. And we want this one. Can you see this? Pull that back a little bit. coming through right there. Stay on the screen. Sure. Let me just move your whole hand so I can see what's going on. Thanks. Okay, so now we'll pull tight. And there goes the white suture. You can see it coming through there. And get the part. You can see we've got, come back here. See we've got one. And now just by rotating our eye we'll be able to see, we'll get the blue and white one next, just to make it clear what we're doing here. Okay, let's now look down at the tear. Down at the tear. Okay, and now we'll get the black and white one. Which is here, and so now we'll show you we've got all three suture pairs going out anterior, okay? See how we do that? And now we'll go ahead and start one at a time from the back. So we'll reach in and we'll get the black and white striped suture first. And this will be the first suture that we'll tie. Okay, and we'll hold it right there. Pause. Okay, now we're using this instrument just to make sure there's no twist following back. So we follow that out. And then outside your shoulder, we're going to tie a, let me show you the post. That's our post right there. We're going to tie a non-sliding knot. Or actually, it slides so well, we're going to go ahead and tie a sliding knot. So this will be a locking sliding knot. So there we go, there. We'll look down at the tear. See how that brings it down? Okay, come back. Okay, that looks pretty good. Come back in the middle. Yep. So now looks like a pretty stable knot. We'll take our scissors and slide down and cut the suture tails there. That looks good. So now the next step is to get the suture, which as you recall, we'll look down at the top. So you can see the next one's this blue and white one here. Okay. And so we'll get the other blue and white one there. Okay. And so now you can see here how that's going to work. Okay, pause. Okay, now we're pulling tight on this blue and white one. You can see how that tear is almost completely eliminated just by pulling tight on this one. So once we have it down, we'll go ahead and lock it. So more half hitch and then we'll be finished with this. Okay. Now let's show you what we've got. So there, that looks pretty good. We've still got one more suture to tie for the. And remember, it's this white. Show me the cannula in the front. Okay, so we'll tie this and show you some more in just a minute. Pause. Okay, so here's, hold this over here. So here's the completed repair for the rotator cuff. There's the white suture, blue and white, and then black and white right there. And so as you rotate, you can see how that all looks pretty good. I'm happy with the way that looks there, okay? So we're going to tie the biceps tendon suture, and then we're going to finish up and get you back to the recovery room. But I just wanted to show you how that finished cuff repair looks. So good luck to you now. Bye-bye.